Hello, my name is McKenna Whitlow, and I will be performing a head and neck assessment on.
I'm Brett Whitlow, and I consent to be recorded for this video for this class.
Okay. We'll start our assessment with a few questions. Do you experience any headaches on a daily basis?
No.
Have you suffered from any prior head injuries?
Yes.
Okay, could you explain?
I had a few concussions when I was in high school playing sports, and I had a traumatic brain injury a few years ago.
Okay. With your traumatic brain injury, do you have any lasting effects?
No.
Do you experience any dizziness?
No.
Okay, perfect. So the first thing I'm going to start with is an inspection of your head. Is it okay if I touch your head?
Yep.
Okay. So while I'm inspecting your head, I'm palpating your bones. I'm feeling for symmetry of the bones. I'm also looking for any lumps or bumps. Do you have any tenderness as I touch your scalp?
No.
Okay, beautiful. The next thing I'm going to assess is your facial bones.
Mm-hmm.
I'm going to feel right above this bone right here for your temporal arteries. I'm feeling that they are symmetric and bounding. The next joint I'm going to feel is your temporomandibular joint, which I can feel right here below your ears. If you could open and close your mouth one more time. Awesome. So when I'm feeling that, I'm looking for the range of motion, making sure that you can open and close your mouth. Did you feel any tenderness while you did that? Beautiful. The next portion I'm going to move on to is your eyes. A few questions. Do you wear contacts?
Yes.
Okay. Without your contacts, do you have any eye pain?
No.
While you're wearing your contacts, do you have any blurred vision, trouble seeing?
No.
Okay, awesome. I'm going to use a light. I'm going to check your pupils, your pupillary response. I want to make sure that your pupils are equal. They're both round and reactive to light. I'm going to start with your right eye. You can look at me. Beautiful. And come back. Awesome. Another portion I'm going to feel is your lower eyelids. I'm going to bring down your lower eyelids. Make sure that your mucous membranes are pink. I'm also looking at the color of the whites of your eyes, making sure that they're not jaundice. One more thing I'm going to assess is your muscular movement of your eyes. I'm going to do this by holding my finger. You're just going to follow my finger. 1, 2, and 3. Beautiful. I'm going to come back to the middle and start again. 2 and 3. Awesome. So I'm looking at eye movement there. There's no nystagmus present. The next portion we're going to move on to is your ears. A few questions. Do you experience any discharge coming from your ears?
No.
What about ear aches?
No.
Do you have frequent ear infections?
No.
And any hearing loss?
No.
Okay. So the next portion I'm going to feel is the external part of your ears. I'm looking at them. I'm inspecting for symmetry. Looking for color, any lumps, bumps, or tenderness there. Anything? Any
Nope.
tenderness? Beautiful.
Nope.
I'm going to look with my pen light inside your ears. I'm going to pull the pin down and assess. I'm looking for any obstructions. Beautiful. Awesome. You can relax. Come back to center. The next portion I'm going to move on to is your nose. Do you experience frequent colds?
No.
Do you have any sinus pain?
No.
Any trauma to the nose?
No.
What about frequent nosebleeds?
No.
Okay. The next portion I'm going to feel is for your sinuses. You have 2 sinuses here and 2 sinuses here. I'm going to push on them and you just let me know if you feel any pain or pressure. Anything?
Mm-mm.
Beautiful. So after that, I'm just kind of assessing your nose. I'm looking for the symmetry in the movement. I'm going to look inside your nose for any obstructions or a deviated septum. Beautiful. You can relax. The next portion we're moving on to is the mouth. So do you experience any frequent sores or lesions in your mouth?
No.
What about toothaches?
No.
Do you have any hoarseness in your voice?
No.
And what about difficulty swallowing?
No.
Perfect. Can you smile for me? Beautiful. When I ask you to smile, I'm looking for symmetry. I'm also looking at your teeth to see if they're well maintained. That's a good precursor of general health. I'm going to look at your tongue. Can you move your tongue to the side to side? Beautiful. I'm looking at symmetry and movement. If you can stick out your tongue and say, ah. Awesome. When I'm looking back there, I'm looking for your throat and tonsils. I want to make sure that they are not inflamed or any extra redness. I'm looking at uvula movement when I ask you to say ah. Another thing that I'm looking at when I assess your mouth is the color of your lips and your mucous membranes. Pinkness is great if you have any whiteness or any pallor to your lips. That can indicate dehydration, but you look great. The last portion that we'll be moving on to is your throat and neck. Do you experience any pain with movement of your neck?
Mm-hmm.
Do you feel any lumps around your neck?
No.
What about some swelling? Any
No.
swelling? Beautiful. The first thing I wanted to do is check your range of motion. The first thing we'll do is tuck your chin to your chest. Awesome, you can relax. And then without moving your shoulders up, are you able to try and touch your right ear to your right shoulder? Beautiful. And then on the other side? Awesome. And then lastly, just extend your neck backwards for me. Beautiful. And you can relax. Your range of motion looks great. And then I'm going to palpate the sides of your neck. I'm feeling for any lumps or swollen lymph nodes, which you do not have any. And then finally, I'm feeling your trachea, making sure that it's not deviated. Can you swallow for me? Beautiful. I'm also looking for your thyroid, ensuring that you do not have any goiters present, which you don't. And that concludes our assessment. Thank you very much, Brett.
Thank you.